Hello, everyone. So I'm going to try something new today. And what it is we're going to demonstrate some of the things that we talked about yesterday. So yesterday we talked about matrices and what they are for. So today I have out some of the different types of matrices, and I'm going to demonstrate how we place them on a Tibodont so that when you come to the campus beginning next week, I'm keeping my fingers crossed that we'll get to do that, you'll be able to do what I just did. If we have time at the end of the video, I'm going to take out the dental dam equipment and we'll demo that. So please watch the video once I post it because it is very important that you'll be able to do that. So I'm not sure what you'll be able to see on the table. So right now I'm going to show you a couple things. So right now, right here, I have a standard universal matrix, which is right here, which is a Tafelmeyer, and the matrix bands and some wedges. I have out what I'm going to need to put them on, which is basically, turn that around, which is basically an explorer right here, a ball burnisher, a cotton plier, and a explorer. Right here is a Paladin setup. It comes in a box and in a case, and I will talk about that in a second. Right here is the Garrison that I spoke about yesterday. And then here is an auto matrix system that I also spoke about yesterday. So for now, I'm going to show you the old school one, or the Tafelmeyer, which is the oldest one that we have. And some dentists are going to continue to use it. And it's I think it's one of the easiest to put on, but I've been putting it on for a long time. And it's the one I think that's most stable to put on. So here is our Tibodont, and I'm going to make sure that all my, everything's pretty tight because we don't want it moving around when we're trying to put everything on. So one thing I always want you guys to caution about is that, make sure you have everything that you need, right? Like I have it right here. And that, when you put it on, even at the table, that you have your patient lying down because you don't work with your patient sitting up. And also that you have it turned to the side because, we don't work on our patient like this, right? We don't sit on our patient's lap when we work on them. So I do want you to make sure that you have your patient turned to the side. And I'm going to bring this a little bit closer and bend it down just a little bit so maybe you can see better what I'm doing here. All righty. So let me adjust my chair a little bit here so we can get started. So the first thing I want to show you is my Tafelmeyer, which I have right here in my hand. See if I can get a little bit closer with that. There we go. So this is our Tafelmeyer. And let me go over the parts again for you. Right. See if I can get that in focus just a little bit better. Might be too close. Let me go a little bit further away. Right here are the parts again that we talked about yesterday. This is the spindle right here, which gets adjusted by this outside knob or the outer knob. And that goes into this right here, and that's the diagonal slot is right here. Put it on this pink paper. This is the diagonal slot right here. That gets controlled by this inner knob. Is going to move this up and down. I don't know if you could see that or not, but it moves it up and down. Okay, that's the diagonal slot. And this is the guide channels. Okay, so that's all going to help us. The spindle is going to hold the matrix band in the Tafelmeyer so it doesn't come out. It's going to lock it in. The diagonal slot is where the band is going to go feed into. And then the guide channel is going to determine which area on the mouth it's going to go. So if it goes out one side, it's going to go on the upper left and the lower right, and then opposite there. Okay, so here is a Tafelmeyer band right here. It's a number 1. They do come in different thicknesses dependent on your dentist. So this is the side that we load. The side that we load is the side, of course, that has all the slots in it. And then this side, if you look, is smooth, okay? So this is the side that we're gonna see in the patient's mouth. And this is the side that's gonna go towards the gingiva. So if we look here, okay, I'm gonna take, if you look here, right, at my Tafelmeyer band, and they all have this V shape to them, okay? And this side is gonna have the smaller opening when I put my 2 ends together, and the V part is gonna have the larger. So if I put my 2 ends together, right, here's my Tafelmeyer, I'm gonna loop it around my finger, and now I'm gonna put my 2 ends together evenly. So if I look from this side, this loop is actually smaller than the loop on this side. Put it here so maybe you can see it better. If I look here, this loop is actually smaller. And this smaller side is going to go towards the gingiva, and this larger side is going to go towards the occlusal. So I'm going to take my 2 ends here, and I'm going to put them through this diagonal slot. Like so. So all I did was feed it through this diagonal slot, like so. I'm sure you can see that very well. I'm going to feed it through the diagonal slot right here with a little bit hanging out. All right, and then I'm going to either go through the right side of my guide channels or for the left side. So right now I'm going to, and that's going to be determined by what area of the mouth the dentist is working on. So I'm going to pull it through, and then I'm going to tighten my spindle because right now it's going to come out, right? It's going to come out pretty easily. So I'm going to tighten my spindle by turning the outer knob clockwise or to the right, right? Righty tighty, lefty loosey. And now my matrix band is in here pretty firmly. All right, it's pretty firm in there. So now this part is always going to go towards the gingiva. So if I have my little Tafelmeyer here, which means that if I'm putting this on the, mandible, if I'm putting it on the mandible, it's going to go face down, okay? Because the small loop, which you can see right here, if I look at it from this angle, if you could see that very well, but if you look at it from this angle, right, that loop is actually smaller than this loop. Where you can see that better. That's a bigger loop than that loop. Okay, so that's going to go to the gingiva. The size of this loop is determined by this inner knob. So if the diameter of my tooth is larger than that, I can turn this inner knob to the left and my loop is going to get bigger. If I turn it to the right, my loop is going to actually get smaller. You see that that loop is getting actually larger and smaller depending on, so if I turn it clockwise, my loop is getting really, really tiny. I'm if I turn it the other way, it's going to get bigger. Every once in a while, I do need to check this little spindle because it does tend to loosen a little bit if I adjust this knob too much. Okay, so my smaller loop always goes towards the gingiva. So now the way I have it set up, this is set up for the mandibular left or the maxillary right. Okay, if I have it go out the left side of my guide channel, and I can change it. To change it, I have to loosen my spindle just a little bit and kind of slide it over to the other side, tighten my spindle again. And now, because this is the smaller loop should always go towards the side that I've loaded with the slots on it. The other side doesn't have any slots. Now this is set up for my maxillary left or my mandibular right over here, okay? Well, I didn't burnish it because I'm not used to doing that. I've never done that before, like the book says. But I am gonna make sure that my matrix band is nice and round, okay? I don't want any creases in it. So we have a nice little loop here. So this is set up for my mandibular right side. So my dentist is going to do, say, an MOD on tooth number 30. So the first thing I want to do is make sure that my contacts are open so I can slide this through. Now, this goes on after the dentist has already prepared the tooth, right? He's already prepared it. This tooth has the decay's been removed, and now he's gone to check a prophy patient, and he says, go ahead and get this on there for me. Now, the first thing I have to do is make sure that the size of my loop is right. I don't want to have to make a huge adjustment after it's on the tooth. So I kind of want to make sure. So this one is sized pretty well. Okay, so let me make sure you guys can see this. Bring this a little bit closer. It seems to be getting out of focus the closer I bring this. I want to make sure that you can see this okay without it going out of focus on me. All right, so now I'm going to slip it over the tooth. Easier said than done. And I'm going to make it just a little bit bigger. So to do that, right, I'm going to turn this inner knob counterclockwise. Got a little bit bigger. Now I'm going to slip it here. Now, we do have to make sure that the Tafelmeyer is parallel to these teeth. I don't want it sticking out this way. I want it to make sure that it's running with the buckle of these teeth. I do want to make sure, right, that it's going to go about 1 millimeter past the prep. And then I do want to make sure also that it's 2 millimeters higher than this incisal or occlusal edge, okay? Because they always tend to overfill it with material. Once I have it on, I'm going to turn this inner knob clockwise so that the band gets tighter around the tooth. Okay, so I shouldn't be able to just pick this up and take it off the tooth. I'm going to open his head a little bit here so you can see better. I'm sitting him up just so you guys can see a little bit better here, like the way you guys can or cannot see. So that is on. Like so. Can you see how that's on? I'm having a hard time refocusing here. Might be too close, but next time we do this will be better. So it's on, all right? If we make it too tight, what's gonna happen? Anybody? What's gonna happen is that if you make it too tight, it's gonna slip down into the narrower part of the tooth. So we don't wanna make it too tight, or it's not gonna be above the occlusal edge, and it's just not gonna work. So we just wanna make it tight enough so it sits where we want it to sit. Then I'm gonna take some wedges here, and I have, when I talk about wedges, I'm talking about these little, they're shaped like a triangle, kind of like your embrasure. You can see from this side, kind of hard to see here with the lighting, but you can see from here, they're shaped like a triangle, and they do have multiple sizes. They do have multiple sizes. They come in plastic, but usually I just kind of hand a couple of different sizes to my dentist on my hand and let him pick out whatever size is best for him. Or if I'm placing it, I would like look here to see what size I would need. And the matrix is used, right, to reform. I'm not sure if you can see in my mirror, but it's going to go right here in this area. And what that does is it prevents any overhang or any excess material from not shaping to the anatomy of the tooth, okay? And it's also going to push these teeth apart just a little. So I'm going to say pick one, and our Tibodonts have a pretty big embrasure. And on posterior teeth, they always go from the lingual. So I'm going to ask my patient to turn towards me just a little bit, and this gets placed. So if it's an MOD, it's going to be on the mesial and distal, and we take our backside of our cotton plier, and I can push it in there. This is done on the maxillary. It's pretty uncomfortable. It might be a lot of pressure to my patient because you're usually not numb on the palate side. And then I would pass this to my dentist again. And using a locking cotton plier, right? Because if I use a non-locking cotton plier, when I pass it to him, it's probably gonna drop out and fall on the floor. So you wanna use one that has a little lock on it, and make sure that you give it to him so the point of the triangle is facing up. And we're gonna, again, here we are. Okay, so we're gonna put the other one on the distal. We're gonna put a lot of pressure so that we can push these teeth apart. And there we go. Okay, now we have it all set. Oops. We have it all set now to put our filling in. All right. Tibodont is kind of having issues here. Bring on again. There we go. All right. So here, uh-oh. Don't tell me I'm not recording this. There we go. So here we are. We would have our tooth already prepared. And now I could go ahead and do the steps, right? So if I'm doing a composite, I can do my etch, I could do my bond, but the problem here is if I do a composite, what's going to happen, right? I'm going to have a problem light curing it because a large part of my tooth is covered with this matrix band. So here what I could do is I can kind of take this off part way. So what happens at the end of this treatment would be that, so say I cure it from the occlusal, part of the interproximal is going to get light cured, but not maybe the whole thing. So what we can do is we can take this open a little bit. So I'm going to push these wedges out. So the first thing I would give my dentist is cotton pliers to take the wedges out. All right. Then we're going to hold on to the top of my band. I'm going to use my outer knob right here to open up my spindle, because my spindle is what's actually holding the band into my Tafelmeyer. Depending if I ate my Wheaties this morning is going to determine how tight I made my spindle. I'm going to just lift off the Tafelmeyer. Now I can kind of open my Tafelmeyer here, still leaving it intact and approximately. And now I can get my curing light and cure it a little bit more into the interproximal areas like here and here to cure it a little bit more before I remove my Tafelmeyer band, okay, or this band or my matrix band. Then I would just lift it out here. And then your dentist may want you to cure it a little bit more to make sure that the areas that were covered by the matrix actually do get light cured, okay? Then the next thing, right, is that we want to make sure that there's no overhang or excess material. So I could go down between those contacts with a piece of floss. If I have a Hollenbeck, I would use the Hollenbeck. Didn't bring one, but I would go here again to make sure there was, to kind of clean up this area a little bit. And then I would check the bite with some articulating paper, have the patient dry it off with a cotton roll, give my dentist the articulating paper, patient would tap down. If any adjustments need to be done, make any adjustments, rinse the patient out, give them post-op instructions, and we're done. So the hardest thing with the Tafelmeyer band and the matrix is putting it together or learning how to put it together. And then making sure that when you do load it, you know that we make sure that the point is down, that the smaller part of the loop is facing the gingiva, and that the larger part of it is facing the occlusal. Because if not, it's just not going to work out properly. Okay, so those are some of the things that you kind of need to be aware of when we are putting a matrix band on. And it's each one of them have a little bit different way of working. So next I'm going to show you an anterior tooth, because that's another one that's pretty simple. So for an anterior tooth, it's a little bit different. So we do have these clear matrix, these clear celluloid or mylar strips, okay? There's a celluloid strip right here. And they do recommend that you, I guess that's about 4 inches, so they do recommend that you cut them to 3, okay? Pretty simple. And you can see that that's it. That's the whole strip. So in order to make it a little bit easier for it to take the shape of your tooth, right? Because our teeth are not straight and square. We do recommend that you kind of run it over the handle of your mirror, so that now we're making it a little bit more curved, which will make it a little bit easier to, it's kind of shaped like this now. Okay, just kind of curved a little bit. So say this patient now, we're gonna needs to have filling placed. Well, he's missing a tooth. Well, let's say now he needs to have a distal filling on tooth number 9, right? This is tooth number 9 right here. And say we need to do a distal filling on it. Dentist is going to get the patient numb. He's going to anesthetize him, remove the decay, and now we're ready to start rebuilding this tooth. So one thing is you can't lose your celluloid strip, okay? I have it here. It's all ready. I can already look and see maybe we can get our wedges ready. Have everything ready ahead of time because your dentist is going to kind of fly through this. Everything's ready. So first thing goes on. Why is this so crooked? Driving me crazy. Okay, everything's ready. We're going to take our celluloid strip, pass it to the dentist. He's going to put it right between these teeth, like so. He's going to make sure that he's going to go about 1 millimeter past the deepest part of the prep. Like so. You're going to pass him the wedge. The wedge on anterior teeth goes on from the buccal. Posterior teeth, it goes on from the lingual. We're going to push it in with the back side of our cotton pliers. That's it. All right. He's going to put some etch on, right? This is going to protect the teeth around it. We're going to put some etch on. Etch left on for 20 to 30 seconds. You got to read the bottle with the manufacturer's directions. Going to rinse it off for 20 seconds. We're going to dry it. We're going to put the bond on. Depending on the type of bond you have, we're going to, like I said, depending on it, some you need 1 coat, some you need 3 coats. We're going to air dry it. Going to cure it with the curing light. Once that's done, we're going to pass the dentist the type of composite they're going to use. So if I'm going to use looking for something here. So let's say I'm going to use global composite. Curing light will reach all the way over here. Okay, so we've etched, we've bond. So now he's using flowable composite. He's going to put some flowable composite right here. That's pretty much it. Can you see that? He's going to hold this up against the tooth like so to conform it to the shape of the tooth. You will come in here with the curing light. I'm on a wish and a prayer here. So the dentist will hold it like this up against the tooth so it makes the shape of the tooth. You'll come in here with the curing light. Don't look at the light. Hold it up against the tooth. One beep for 10, 2 beeps for 20. It'll beep again and it'll stop. And then it turns off. That noise is the fan cooling it. We'll take the wedge out. He will take the celluloid strip out. And we have a filling here that is hard and cured. Okay. I was looking at that blue light and all I see are blue dots. All right, so now we have a filling right here. And now all it needs to do is to be shaped. He'll remove any of the excess composite material that say, well, this whole thing is on the tooth, but he would remove any of the composite material that's on the natural tooth and not in the cavity prep spot, okay? he will use some soft flex discs on the low-speed handpiece to contour this filling, right? He'll make it look absolutely wonderful, okay? And once that's done, he will, like I said, he'll check the bite with some articulating paper, rinse the patient's mouth out, and now this, give him some post-op instructions, and that'll be it. Now this isn't going to stick to this tooth, I don't think, or it shouldn't, because there it goes. So it's going to come off because we didn't use any bond on this tooth, right? And no any edge. So that's basically everything for an anterior tooth. They're pretty simple. Dentists do absolutely beautiful work with them. So for anterior, all you need is this little celluloid strip and some wedges. Pretty simple, okay? Now I'm going to show you another one, okay? So that is a Tafelmeyer band and a matrix. I showed you the anterior one. And now I'm going to show you another one because you never know. Because the Tafelmeyer band and a matrix, a lot of dentists do not use them because of their inability to cure. I'm going to show you the Paladent, or a sectional matrix. The whole kit comes with basically everything you need. It comes with these little tweezers. It comes with these little matrix bands, like so. They're like these little, they're made out of the same material as a matrix band, but instead of being a huge piece of matrix band, it's just a little tiny thing like this, okay? And they actually have like a little holder on it to make it easier to place in between the teeth, like so. You see that little tab that sticks up from the top? So that faces the occlusal of the tooth. It also has comes with its own little wedges that are also like color coded. Comes with these little wedges that are kind of funky shaped. And then these are the clamps that are going to hold it on the tooth, all right? So the first thing that you would do is, I'm just going to do one side. So if we did like a mesial on tooth number, let's do tooth number 29. I'm just going to use this one because it's the one I got out. So first goes our little band goes between the teeth. Like so. And then you can actually take off this top part, the little jiggy hoo. The little top part comes off pretty easy. And then the wedge would go in. They're shaped also like your embrasure. And then the wedge would go in. And they're color coded also. But not every tooth, say, is color coded. So they do come in different sizes. And then this would go in next. Right. Oh, sorry, it goes in from the lingual. Like so. And then this clamp ring goes on, and we use this. Looks just like a dental dam forceps, doesn't it? Except these tips are a little bit bigger. And then this, and the tips fit right inside this little portion of the ring right here. Okay, so that we can put these tips right in here. So we don't lose it. And then that goes on top of the matrix. But let's turn it the other way. This way. To hold it in place. And that's what that looks like. And again, I'm not sure if you could see it really clear. May have to get a different camera. Doesn't seem to be focusing really well when we get too close. I may have to ask my IT guy why that's not working, but. So now you can see that it actually has more access, say, to the curing light. If I move there, but you can kind of see how it's on. So the matrix band is very tiny, and actually it's very thin when you work with it. It's not as, it's much more flexible. So that's how that works. And you can actually put it on multiple teeth if you need to, right? So now when we take it off with my cotton pliers, with my forceps here, I'm gonna take it off the same way I put it on, like so. And I can remove the wedge. I can actually remove it all at once. So the thing I don't like about this is that it's just kind of flimsy. And, you know, when you put it on, it kind of rocks around a little bit. But that's just me. You know, I haven't come in a lot of contact with it before. So, or a lot of practice with it clinically. Right, so that's a pallet dent or a sectional matrix. Another one we have, and I like this one personally, and right now the one I have is a steel one, but it does come with a celluloid strip on it. And so it does come with a clear material on it, similar to this one, but instead of being clear, I've seen them tinted like a light bluish color. It makes it a lot easier to see. So this apparatus is called the Garrison. And Garrison is just a brand, is a type, but they also make a sectional matrix. So this, you can see, right, it's round. It has a smaller side where the loop is smaller on one side and bigger on the other, just like a regular Tafelmeyer, right? This loop is smaller than this loop, so this loop goes towards the gingiva, all right? The smaller side. They come in different thicknesses, just like a regular Tafelmeyer. And now this is the instrument that we use to tighten it with. When I push this up, this ring up, you see these little jaws come out right here. Okay, you see these little jaws come out. When you put it in, they go away. So I'm gonna, and they fit on here like so. So you put the little jaws out and you put this middle part inside this hole that's on the top of my matrix, like so. And then you pull it down and it holds on to it. Pretty spiffy, right? All right. So I'm going to turn it the other way so I can put it on the tooth. This time, let's try to put it on a maxillary tooth. So I'm gonna turn my patient around since he keeps losing his mandible on me. There we go. All right, so now let's go ahead and put this on tooth number 2. Well, obviously it's too small, so let me get a bigger one. Let's see here. Another bigger one. This one looks pretty big. So I'm going to make sure that my loop is nice and round. Okay. The smaller side goes towards the gingiva, right? So you can see here that this side is actually smaller than the other side. That's bigger than this side. I'm going to take my tool. It's got its little jaws sticking out. I'm going to put it in the hole right here that's on my matrix band. I'm going to push this knob down and it's going to hold on to it. I'm going to slip this between the contacts of this tooth. I think it's the lighting in here is so bright. I'm going to slip this through my contacts of my tooth. I could actually do it without on here. It might be easier. Always keep track of your instruments. Don't get them all confused. I'm going to slip this on my tooth right here. I didn't do one step, but I didn't make sure my contacts were open, but there we go. It slipped on. Now I'm going to take my wrench, so to say. Right now my person has a cheek, right? So I can't come in this way. I got to come in from the anterior of it. I'm going to turn this clockwise. And my matrix is getting smaller. So it's adapting to the diameter of the tooth. So now it's not going to lift off very easy. I'm going to pull this, push it up so I can remove this because we can't work on the tooth with this on the patient. The doctor can't do anything. So now it's fitting pretty well. So what's the next step? Do you guys remember what the next step is? Once we get the matrix band on the tooth, the next thing we have to do is put in a matrix. So if I'm doing a DO, what side would the matrix go on? The wedge go on? It's going to go on the distal side. So I'm going to pass my dentist a wedge with my locking cotton pliers. Hopefully it doesn't go flying. Right, he's going to go in here from the distal, or you'll go in here. Well, this patient already has something in there from the distal. I don't know if you can see it or not by looking in my mirror. There's something right here. It doesn't look like my patient brushed this morning. I'm getting some food out from between his teeth, which is gross. No, I'm just joking. All right, so now I'm going to take my wedge with the point base of the occlusal. I'm going to put it in on the distal because that's where the prep is. We're going to push it in. Because what does the wedge do? It conforms the band to the anatomy of the tooth, and it's going to push these teeth apart just a little bit. I'm going to take the heel, push it in all the way. That looks good. That looks good, right? Because the matrix band is about 2 millimeters above the prep. Can you see that? It's very disturbing. I'm not quite sure why it's not focused, but I'll figure that out. At least you're seeing what I'm doing somewhat. Tooth gets prepped. If it's a composite, again, we do run into that same problem, but like these do come as a celluloid strip. So we can use the Garrison with a composite. Once it's finished, cotton pliers, okay, cotton pliers. The wedge comes off, comes out. We pass him the wrench, open up the jaws. It goes in the same hole, gets closed. We turn it the other way so that we can loosen the matrix now. And this should actually loosen enough. There we go. That we can use our cotton pliers to wiggle this out. Now, you don't want to take this off unless you know it's set. And that's one of the problems with some of these, because if you're using it with an amalgam filling, right, it's not, amalgam doesn't set for like a full 24 hours. So that's some of the problems. So that's Garrison. And I have one more to show you before you leave for today. Don't forget, after you use your flowable, you take this off, take off the tip, you put your original cap back on. Because we don't want oxygen to get in there and we don't want it to oxidize. All right, this is the last one, which is called an auto matrix. And it looks like this, right? And this slot right here is a cutting tool. Okay, it's used to cut it off when we're done. And then this is the wrench. It's similar to the wrench on a Garrison, but you can see it's shaped different. And then we have different sizes. We have a narrow, a medium thin, a medium regular, and a wide. That has to do with this part. When we talk about medium and narrow and medium, narrow and wide, that has to do with this part of the matrix being narrow, medium, and wide. Okay. Thin and regular has to do with the thickness of it. Okay. The thickness of it. And how this works is that on the Garrison, the wrench, you know where the wrench was, but on this is the wrench. Okay, it's a little bit different than the wrench that you saw before. So instead of having those huge jaws that go into it, this time the wrench goes into this little tiny hole that's right here. Not sure if you can see it, but it goes into here on it. Really can't see it very well, but it goes in there, okay? And then when you turn this clockwise, this loop will get smaller. Again, same as before, we have a smaller loop here that goes towards the gingiva and a larger loop that goes to the occlusal. So here we are we're going to put the matrix band around the tooth that we're working on. So let's do a MO on tooth number, upside down, 3. It's going to go on the tooth like so. See, maybe there's something approximately here. So let's see if there's something there. Oh. We're going to put this here between the teeth, right? And you see how this like bows out? Can you see how that like bows out at the top? It like really flares. That's basically why I don't like it, but Dennis likes it. That's all that matters. And then the wrench is going to go in here. And then you will turn this part of your wrench to the right, or clockwise, not counterclockwise, until the matrix band is tight on the tooth. Kind of made it too tight, so it kind of dropped down. You see how it dropped down? It's not high enough above the occlusal right now, and that's what happens if you make it too tight. But you see how much space there is, like right here? So that would be good if like there was a lingual pit, but I don't know. That's just Miss Franks. My husband says I can find fault with everything. The way my daddy used to be. Anyway, let's put that on. Then we use the wrench to tighten it, like so. Then you try to get the wrench out. Again, we're doing an MO, so we're going to take a wedge. It gets placed on the mesial side from the lingual, because lingual on posteriors. Push it in. Again, it has to be big enough where it's going to wedge these teeth apart a little bit, but also push the matrix band to the anatomy of the tooth to prevent an overhang, which is excess material. But you see how, so you see how this is like bowed out right here? Anyway, okay. But actually you can kind of contour it, I guess, if you wanted to like adapt it, maybe, I don't know. Anyway, filling gets done, light cured, and it does maybe give you the ability to light cure it better. Procedure's finished. Cotton pliers to the dentist so that the wedge can come out. Or if you're doing it, make sure you always take the wedge out first. Next comes the matrix band needs to come off. And that's what this little doohickey is for. It's so that you can cut this part of the matrix band. It has this little protector on it so that when you cut this little metal piece off, it's not going to fall into the patient's mouth. So we open it, you cut this right here. You saw how it just kind of, it fell in here, hopefully. But always make sure that you're ready with the suction or the HVE. So in case it didn't fall in there, you get ready to suction it out of the patient's mouth. And then, sorry, and then this should actually just, there you go, open up and come off. Once that's done, the dentist will tell you what he wants. He may want the Holland pack or the IPC, the interproximal carver, to come in here, make sure there's no excess material that needs to be removed. He'll always check it, well, I'll say always, with floss. Make sure you give him enough floss that he can do it. He doesn't want this much floss. He wants to take his floss, wrap it around his fingers, and come in here and make sure that the patient's not going to get his floss stuck when he flosses. All right, check the bite with articulating paper. Make sure it's comfortable. The patient is going to rinse, and we give him post-op instructions. So what are the post-op instructions? The patient's going to be numb for a little bit. Be careful of anything too hot or too cold. If you have any problems, give the office a call. If you have any problems that over-the-counter medication doesn't take care of, or whatever you usually take as far as pain medication is concerned. That's it. Well, I hope you enjoyed today's demonstration. It's just about done. I will try to maybe one day next week or before the end of the mod, I will do a dental dam demo, or we will come in and hopefully be in class on Monday. Anyway, everybody have a good night. I will be back with you tomorrow. See you then.